Good evening, everyone. Thank you for taking the time to view my presentation. My presentation is regarding Spectrum Health and a few of the information systems currently utilized by the organization. Spectrum Health is an entity that was formed in 1997 by the merger of the two largest hospitals in Grand Rapids. Those hospitals were Blodgett Hospital and Butterworth Hospital in downtown Grand Rapids. Since the merger, the system has grown immensely. They currently have 230 ambulatory sites, which include practices, specialty practices, labs, outpatient centers, urgent care centers, and 14 hospitals. Those hospitals are spread out through Western Michigan and the Northern region. They are the largest employer in West Michigan, and the system offers care in every healthcare situation. They have a designated children's hospital, a cancer center, trauma center, and currently performing heart and lung transplants. Spectrum Health is the premier healthcare system in West Michigan. What technology systems are important in healthcare? When I think about that, the first thing that comes to mind is the healthcare system's electronic medical record. The electronic medical record is vital in patient care, and the system that Spectrum Health currently utilizes is Epic. How does Epic impact Spectrum Health? Patient information is available in one place throughout the system. They recently implemented the use of Epic in the inpatient setting, where previously we had used two separate electronic medical records. This allows providers to be able to see patient information in real time and not have a breakdown in care due to having two separate medical records. Providers are able to place orders and referrals internally and externally within the system. Another function of Epic is a part that is called Care Everywhere. Care Everywhere has transformed care across other healthcare systems. What this allows us to do is to see health information from other systems which also utilize Epic. For example, the University of Michigan and Sparrow Health System in the Lansing area utilize Epic. So if a patient has received any care in those systems, we can access their records from our system as well. And it's customizable for users in many ways. You can set up preference lists, smart lists, things that where with a few strokes of a key, you can have those things that you do on a day-to-day basis pop up in a much quicker fashion. The main weakness of Epic is a system outage and no backup. When the system goes down, we do have business continuity computers available in all of the locations, but all that allows us to see is the last office visit or encounter that a patient might have had throughout the system. We cannot enter information into the system. We cannot place orders. We have no backup, and the healthcare record is essentially limited to what we can have. So when the system goes down, the process that we have to go through and the patient care that our patients receive is at a much slower and inefficient rate. The next system I want to talk about is API Healthcare. API Healthcare is utilized for employee time management. So the processing of the hours worked, vacation time, sick time, bereavement time is all calculated within API Healthcare. It tracks attendance, scheduling, and staffing, records the hours worked, staffing shortages. Staff can put in vacation requests. It calculates the overtime that is what happens on a week-to-week basis, so we can alter staffing as needed. It offers detailed reporting functions as well. Staff attendance, tardiness, hours worked, vacation hours taken. And the staff also has the ability to assign their hours to other cost centers. For example, if I have a staff member who is currently working at our location today, but then working in another practice on another day, they can log into that cost center and their hours and wages will be charged to the location at which they're working. The weakness of this, in my opinion, is there's no automated responses from the system. For example, the staff member who requests vacation time, I will receive an email that indicates there's a request that either needs to be approved or denied. I can go into the system, either approve or deny that request, but no response is automated that generates back to the staff member. then I have to take it upon myself to either email the staff member of an approval or denial or have a discussion with them face to face. If the system could automatically generate that response, it would save both time and effort on the supervisors or approvers' part in more timely answer or more timely response back to the staff member. The last system I want to talk about is the telephone system that's used throughout the Spectrum Health organization, and that's Cisco Healthcare. Cisco Healthcare tracks our incoming and outgoing telephone calls. Um, all of the calls come into a queue, which users have the ability to log into. Reports are available to track a multitude of data within Cisco Healthcare. Total of incoming and outgoing calls by logged in user, the average length of call by the user, and the length of time the users are unavailable. If a user is unavailable, that means they're not logged into the queue and able to accept any incoming phone calls. It offers you the ability to see what users are logged into the system and what users have remained unavailable for extended periods of time. The weakness of this system is it's internet based. No internet equals no phones. And on occasion, we do have outages. And in that event, we may have patients who are trying to contact our office, or we're trying to contact patients um, externally, and we have no access to the outside world. This can lead to frustration both on the patient's part and staffing part as well. Thank you, and I look forward to your feedback.